The American Medical Association is calling for vaccine mandates as the spike in new coronavirus cases among unvaccinated Americans becomes more and more dire by the day. In fact, they released a statement arguing that the simple fact is, unless a significant percentage of our population is vaccinated against COVID-19, we could be stuck fighting this virus for many more months or even years to come. Now is the time for the public and private sectors to come together, listen to the science, and mandate vaccination. In fact, airlines like Delta are planning on penalizing their employees if they refuse to get vaccinated. They're like, look, yeah, we live in a free country and everything, and you don't have to get vaccinated if you don't want to, but you're gonna have to get tested regularly, and we're gonna charge you an additional $200 a month for your health insurance premium. What do you think about that? So look, there are coercive methods that are being used right now to get people vaccinated. Some companies aren't playing those games. Some companies are just like, yo, you need to be vaccinated. If you don't want to get the vaccine, then we can't employ you, which is also coercive. So I don't think that we should lie about the fact that it's coercive, but I think that the vaccine mandates make sense, because you want to keep your employees safe. And if some of your employees refuse to get vaccinated, well, that creates an unsafe situation. And look, at the end of the day, companies don't want any liability issues. So if you have someone who's unvaccinated, if you have people spreading a virus to people who are unvaccinated within the company, not only is that gonna hurt productivity and profits, which they care a lot about, of course, it could become a liability down the line. So that's part of the reason why the private sector is implementing coercive methods to get people to get the vaccine. But when it comes to the federal government, as we know, there are no vaccine mandates. And when it comes to some red states, there have been some pretty serious ramifications for the intentional disinformation that people have been consuming. But more importantly, some of the actions that have been taking place, that have been taken by governors in the form of mask mandate bans and what have you. So let's go to Arkansas, because I'd like to give you guys an update on how dire the situation is in that state. So Governor Asa Hutchinson announced that Arkansas on Tuesday ran out of intensive care unit beds for COVID-19 patients for the first time. For the first time since the coronavirus pandemic began, the state's ICU capacity for COVID patients barely eased hours after Hutchinson's announcement, with only one hospital in Southeast Arkansas showing availability. So if you are incredibly sick, you are unvaccinated in Arkansas, and you happen to get COVID and you need to be hospitalized, you need an ICU bed, you might be out of luck. Now they're trying to figure out makeshift situations. They're trying to figure out what to do in order to increase the number of ICU beds. But right now, they're scrambling. It's a very difficult situation because so many people are hospitalized. So many people are getting sick in the state. Virus patients actually make up about half of the state's ICU beds. The number of virus patients in ICUs and on ventilators actually reached a new high in the state on Monday of this week. Arkansas, when it comes to vaccinations, ranks 5th in the country. Arkansas ranks 5th in the country for new cases per capita, according to figures compiled by Johns Hopkins University researchers. Arkansas has one of the lowest vaccination rates in the country, with 40% of the state's population fully vaccinated. So not even half of the state is fully vaccinated. And so the state on Tuesday reported more than 2,200 new virus cases and 45 new COVID-19 deaths. So to make matters worse, and this is an important part of the story that doesn't just impact Arkansas. Unfortunately, now we're seeing it impact all states because of, again, very intentional disinformation campaigns. What's making things more complicated is this whole Ivermectin debate. There's this conspiracy theory that alleges that this livestock medication, it's typically a livestock medication meant to deworm livestock, is actually effective in treating COVID, but the government doesn't want you to know that. Big Pharma doesn't want you to know that, and so they're hiding this information. None of that is true. Merck, a pharmaceutical company, produces ivermectin. So to say that you should take ivermectin because it's not a big pharma product is ridiculous. But more importantly, there are not studies proving that it works against COVID-19. And I want to explain some of the myths out there. I want to debunk them by showing you the evidence and the data. I want to start off with the context. So the state health department on Tuesday also issued an advisory warning people to not use livestock medication or medicine to try to treat COVID-19. The advisory follows an uptick in calls to the Arkansas Poison Control Center about people taking ivermectin intended for animal or livestock use. Now, is ivermectin ever used for humans? Yes, in doses that are appropriate for humans and for a very specific purpose, if they have roundworm. Now, if you are a human who's suffering from that parasitic situation, then talk to your doctor because ivermectin might be an option for you. But roundworm is different from COVID. Let me repeat that again. Roundworm, a parasite, is not the same thing as the coronavirus. And for anyone who's also alleging that the National Institutes of Health have done research on this, the NIH has done research on this, that is not true. So there was a study published on the NIH website, which is a platform that publishes various studies, right? They'll have the study might exist on that platform, much like, I don't know, the TYT Facebook page exists on Facebook. That's not to say that TYT is Facebook, okay, or that TYT is a Facebook product. You get what I'm saying? The NIH, the website, is a platform where all these studies exist. People can read various studies. But here's the problem with the study that keeps getting cited. It was already rejected because of fraud. And since it was a meta-analysis, meaning that the study looked at various studies to come to a conclusion, many of those studies had sample sizes that were too small. So it was riddled with issues. I want to give you the details on that. So let's go to the next graphic. The National Institutes of Health, this is what they actually said in February that most of the studies related to ivermectin and the coronavirus, quote, had incomplete information and significant methodological limitations, including small sample sizes and study outcome measures that were often unclear. And when it comes to one of the study authors, he was asked, hey, what's going on? Is this a conspiracy? Are they trying to suppress the information that you're trying to get out there? Is that what's going on here? Dr. Andrew Hill responded to that and said this: our meta-analysis of survival for ivermectin had to be retracted after one of the main studies was suspected of medical fraud. With the revised version, there is no statistically significant survival benefit for ivermectin. So the original version should not be quoted. That was one of the study authors. The study, by the way, that keeps getting circulated online as some, proof that ivermectin is a treatment for COVID-19. It's not. And by the way, they're still studying it. So in the future, could they maybe find that it could be effective? I don't know. The point is they're studying it. As things stand today, your best bet in avoiding hospitalization or death as a result of COVID is getting the vaccine, which, great news everybody, the Pfizer vaccine now has full approval by the FDA. So why would anyone take medication that's really meant for livestock and is not proven as a COVID-19 treatment when they could just get vaccinated by something that has full FDA approval? Don't be stupid. Get vaccinated, and stop watching dumb content on YouTube.
Thanks for watching The Young Turks, really appreciate it. Another way to show support is through YouTube memberships. You'll get to interact with us more. There's live chat emojis, badges. You've got emojis of me, Anna, John, JR, so those are super fun. But you also get playback of our exclusive member-only shows and specials right after they air. So all of that, all you gotta do is click that join button right underneath the video. Thank you.